everybody. Cameron Hemphill here, your host of the Medical Millionaire Podcast. Thank you so much for taking the time to tune in. My goal is to give incredible value and insight for practice owners. Guys, I absolutely love what I do. I've had so many providers on lately. I feel like I've been definitely something in the water around having so many wonderful providers on lately. And a lot of times we have tech people on, we have private equity groups on, we have anybody that is supporting the medical aesthetics and elective wellness industry on. Today, I have a wonderful guest on. We are going to be talking about the industry of aesthetics and wellness and what's been avoided for years. Women's intimacy, wellness, sexual health, confidence, how aging impacts not just the face, but also the entire body. We're going to be talking about all sorts of intimacy, how it affects your husband, your significant other, your plus one, your family. And, we spent billions of dollars every year helping people look younger in the mirror, but women have silently dealt with dryness, laxity, discomfort, loss of confidence, hormonal shifts, and painful intimacy. So I'm going to welcome Bushra to the show. She is the founder of Lysty Aesthetics and Wellness. She knows everything about this topic. She's a wonderful provider out of the East Coast area. Thank you so much for joining. Welcome to the show.
Thank you so much for having me. I'm so excited that you're creating a safe platform to discuss something that has been overlooked for many years and allow women to get empowered and talk about things that they don't feel comfortable talking because society has said it's not okay to talk about.
Yeah, it's like this silent discussion that's only able to be had during like closed doors, and it should be talked about more. We should normalize it, right? Because this is an important part of our lives, and not only do we want to feel confident from an exterior standpoint, we absolutely have to have that confidence from within, and you know that more than anybody. And so, look, I think we jump right in. I want to make this a very impactful episode for all the providers and listeners out there. And, talk to me, what is like one of the biggest mind shifts that you have seen happening right now when women are starting to realize that they don't have to separate sexual wellness from aesthetics anymore? I mean, we've normalized skincare, we've normalized Botox, we've normalized hormone optimization, but now the conversation is becoming, why shouldn't intimate wellness age gracefully too?
A big thanks to social media platforms. It's allowed women to not only take care and talk about their external beauty. So we've normalized Botox and skincare. We've normalized weight loss and hormones. We've normalized fitness. Now women are starting to understand that we can normalize talking about intimate wellness and things that have been considered taboo for too long. Oftentimes, society has conditioned women to believe that after you give birth to a child or you age, you just kind of like have to deal with it. It's part of the aging process and take it with grace. But the reality is, tying into the mental wellness and the discussions on surrounding mental wellness, is that women are starting to feel that they're categorized at that perimenopausal, menopausal stage, that they're a little crazy. But the reality is they just need to feel themselves again in certain areas that are not openly talked about.
So drill in on that with me. I mean, how long have you been doing this?
I've been doing this for 15 years. I actually started my career as an OBGYN provider. So I definitely have an upper hand in feeling very comfortable talking to women about their sexual wellness and their private parts and break that boundary where they feel uncomfortable and they don't know how to talk about it. So I have that upper hand in the sense that my early career started off in women's health, and then now I just tied it in collectively.
And your practice is located, I said the East Coast. I want to say New York.
I am in New York, so I'm in Long Island, New York.
Okay, got it. And how long have your practice been around, you said?
So my practice has been 2 years, and then we're opening our second location soon. So in 2 years, we've surpassed the growth that I've ever expected for myself.
I love it. Okay. Well, I mean, I love having providers like you on. Look, even men struggle with this, right? I struggle with it. I have a wife, she's 43, and she's absolutely beautiful. You actually had the opportunity to meet her at the conference. But she struggles with this. We have 2 kids. My oldest daughter is 12. She's going to be a teenager in a couple months. I can't believe that. My youngest is 11, and she struggles with it, right? And it's almost like this age. I feel like 38, everything is fine. Once you hit 40, I don't know what happened, but things started happening, conversations. Like, I feel like in a way, not only are you helping the female, you're helping me, the male, and the family. So walk us through that. Like, what happens? Because I'm curious as well, just as a male, but like for the audience, what happens? How do you solve this? How do you address it? And how do you achieve like these amazing outcomes and put these women on a, I don't want to say mission, but maybe a journey, a path to feeling confident again and creating intimacy within a couple's environment?
I think to answer your question, in order to address it, the first thing is to acknowledge that there is not a problem, but there is a condition that needs to be managed and there is a solution. How do we address it is really education. Women are so much more educated today and aware of their options and are finally given the permission to feel empowered within their own sexuality. Definitely, women's health in this particular realm, in this category, does affect their emotional and mental well being, which reflects on their confidence, which then reflects negatively on their partner and even on their children. I'm a mother. I have 4 children. I'm also a wife. I'm also a friend and a daughter. And after giving birth to all my children, things change. And somehow we're considered to think it's normal and you don't feel like yourself. And now you're angry with your partner, you're angry with your child, your hormones are shifting, they're going through a tornado of change, and you're not able to express what is going on physiologically with your body. That chemistry all circles down to the same outcome.
So is that, yeah, that makes a ton of sense, right? It's, I don't know, I guess from a man's perspective, it's almost like when the kids start to get older, she starts to age, things happen, right? The vagina ages just like the face ages, right? According to, the body and you guys, from a
100%.
provider standpoint. Is it, is having kids affect it? Like,
So the biggest misconception is that intimate wellness is only for women that have given vaginal birth or are older in age. However, there are women that lift a lot of weights, so they have prolapse. There are women that had sexual traumas, they have changes in their vagina. Those things are not exclusive just for women that have given birth. However, with that being said, your birth canal and your vagina does take a toll once you have a baby. And depending on how many babies you have and the weight of that child and the method of delivery can augment and affect your woman's part. Early on in my career, I had a patient. She had a vaginal birth, ended up with an extreme laceration, which we did repair. She came back to the ER, and I was consulted on this patient, and her suture had ruptured. And I remember going back to my attending at the time, and I said, "Oh my God, let's stitch her back up." And he said, "Oh, nope, it popped, and that's that. Now she's a hallway." And as a woman at the time with one child only, I was shocked. I was like, "What? You're just gonna leave her like that?" So I told her, like, "Hey, why don't you reach out to this other doctor? He does cosmetics and he can fix it for you." In which she did. But there should be proper education to these patients and proper care, and not just be like, "Well, you had a baby, tough luck."
so you said give her a pop and you're like, should we stitch it up here? You were an OBGYN when that happened. I mean, still, but is that,
So the insurance dictates a lot of what you can do and not do. And once you've done that initial suture, unfortunately, if they come back, it's not considered a fresh wound. And therefore, if I would have to go and create a wound and restitch that up, it's not covered under her insurance. And now it falls under the category of cosmetic.
okay. And you mentioned the word hallway.
I didn't mention that actually. That's what my attending had said. It's like, oh, now she's a hallway because,
Oh
you
my
know, if you
gosh.
have third degree tear, that
Yeah.
structure is, open.
Permanently.
Right. And that's going to affect that patient if she doesn't seek care because now she's going to have lack of sensation, lack of confidence. Her partner is going to feel something different. He's going to feel uncomfortable talking to her about it. She's not going to want to have sex because now it's going to play in her head anytime she's laying, oh my God, I feel like this. So these things really truly affect mental health for our female patients. It all ties down to it, to be honest. It's a full 360.
Okay, so she went through this vaginal birth, right? There's a problem there. Apparently, there's a protocol within the hospital. Insurance gets in the way. There's some sort of blocker that takes place. Hey, this is the thing. This is a protocol. Next patient in the door, please. Is that one of the reasons why you got into what you're doing now? Were you seeing a lot of those stories, and you're like, wait a minute,
In
there's
all honesty, no. I
okay,
never wanted to be an OBGYN provider. I wanted to be in the OR and I got a great opportunity. I got a great job at a really elite hospital and I said, fine, get my foot in the door. I was a new grad, but what happened, it was a world of opportunities for me. From there, I ended up working with one of my attendings in cosmetics and I ended up working in the ER. So I have a world of experience from that one opportunity. And I realized that I'm really passionate about women's care only after being in it, because I'm very opinionated and I voice myself. So for my patients, I would be like, no, well, don't do that. I'm not going to do this. And then, being a woman myself, having a child, kind of put things into perspective much earlier for me. I was a teen mom. So I had those experiences to kind of like fall back on as well, and things that I wanted for me differently at a younger age or for what I wanted for future me. And that was kind of where this all came into play.
I love that. I mean, bless your heart. Like literally, for somebody that can see a path, have a passion, and execute. I love that, and obviously all the families that you've helped is when that particular female went through that, and did she go see another cosmetic surgeon and get that?
So, um, technically, I shouldn't say this. You're not supposed to refer a patient to another practice where you work, but it was cosmetic versus hospital care. So I felt confident in doing so. So I referred her back to the same office where I was already doing GYN cosmetics in addition to other cosmetics.
And I'm sure she's pleased with the result and the outcome.
She was definitely happy. I'm sure her partner paid for everything, obviously was out of pocket. I don't keep in touch with her anymore. It's been, over 12 years, but I'm sure she has a happy result and she's great.
A happier result than what she would have been left with, right? With not knowing and being under all that pressure and all that stress and just the protocol, right? So like,
Right.
So I'm curious if I'm a female and I am referred to you, I come see you, I find you on Google, wherever I hear about you. When I come in, talk me through and walk me through that consultation process. How do you go about it? How do you figure out a baseline, and what type of protocol or system do you put them on to achieve results? Curious about that.
Sure. So on the initial consultation, I ask a ton of questions and I listen. I don't really guide their choices or their treatment options just yet. So I need to analyze, are we talking about a hormonal change? So potentially this patient needs hormone replacement therapy. Are we talking about something that peptides come into play? Are we talking about self-esteem and confidence of external beauty of the vagina, external beauty of the face? Or is it truly internal in that capacity? Once I've narrowed down which one of these categories, I'll do a bimanual exam and I'll assess the female's organs and the vaginal area and guide one treatment over the other. I have several devices in my office that can be utilized to treat different conditions. So based on that patient's presentation, I would recommend one thing, two things, or all of those things.
Let's pretend I want all of them, right? I come in, I'm not feeling great. I feel something's off. I hear that, right? Something's just off.
What's
And I'm with
off?
myself.
How you feel
Yeah, I guess
emotionally?
emotionally, I feel maybe disconnected to my husband. I feel like we used to have sex more often. There's not much feeling anymore. I'm not as motivated anymore. And by the way, I've had like 3 kids. So like, I'm not really confident about how my vagina looks. All the things. I hear you're the gal. Like I was told to come see you.
Amazing. Amazing. This is a very complex presentation, but an easily dissectable one because there are multiple factors here that we're addressing. With regards to how she's feeling connected or disconnected from her partner, it can very much be that sexual component because she's just not feeling that she wants to have sex. And when you check that off and you fix that, then she's more connected. But if the disconnection is because of, let's say, he's condescending, he's abusive, then I would refer her out to proper, resources that would better help her, that are more important than me. But let's just say that her concerns are something that I can address. I'm going to have that, conversation. What's your budget? So based on her budget, I prioritize what is bothering you first. If she tells me, I really just want to have good sex, I'm just not feeling confident by how my vagina is looking, I'm going to address that first. Because once you address the thing that bothers your patient most, their confidence and their self-esteem and their desire and better quality of life just goes up this way. So I never go for what I want first. But let's say she has all these complaints and she's like, oh my God, my skin is just really bothering me. I don't feel sexy. Then I'm going to address that complaint first. So really kind of, my consultation will guiding you one path or the other based on their budget and what really bothers them most. But I tend to try to stay comprehensive with majority of my patients. I'm blessed in the sense that my patients don't have really a budgeting issue. So we do a timeline. So today we'll do XYZ. I see you in 4 weeks, we'll do XYZ. Maybe in between these two, we can do this, and we create a treatment plan.
A full vagina rejuvenation treatment plan.
Yeah, it can be something as simple as, when I have sex, it hurts. And this patient might need to help with lubrication, a simple prescription can do. A device treatment may be utilized. Some PRP injections may be utilized. It just kind of really depends. Even a peptide might help get her to go on. Her hormones might be a little bit off, so I supplement and she's great. Sometimes the solution can be this tiny or this big. It just really depends.
What is this peptide I keep hearing about, TP141?
So I like to describe peptides as like she's a mother and she has multiple children, and they, depending on which one you use, you may get a better outcome. This particular peptide will address some sexual wellness in terms of libido, excitement, and how it works in the body.
Okay, yeah, I was curious about that. I've heard things about it. I mean, it's like peptide overload right now for
There's too
people that
many.
are on social media. It's like you don't know where to go. It's like throw it all in a soup, try them all. I mean, I'm assuming as we continue to understand peptides, use them. I have used them, and better protocols will come. Right, like I'm excited for the future of peptides. I'm excited for the future
So
of all the replacement
I
therapy. I
think
still
the
think we're in early stages, but
right provider, right patient, they are life changing.
they are. And there's, in fact, you and I were at that conference, at the BAI conference, and I was leading the panel as a moderator for the longevity wellness panel. I think it went over by an hour because it was such an exciting, interesting topic, and there is also a lot of opinions, right?
Absolutely.
And you get all the providers in one room, and fireworks can start happening.
It's a super exciting conversation. I wish it was longer as well. I had a few questions for the panelists. We didn't get to that part, but it's a great conversation.
It's definitely so. Like for the listeners, guys, if you're ever at a conference and you go to the longevity panels, or if you ever see that topic, that headline, sexual wellness, intimacy, how to build this in your practice, whatever, and it's a panel, it's always going to be a great discussion right now because it's a massive topic of conversation, and we're desperately trying to solve that, right? And Bushra is really doing a wonderful job. So, a couple questions for you. Why do you think women are finally becoming more open intimate wellness now? Like, why it's I have seen it open up in the last 3 years more than ever.
Women are becoming more empowered. Honestly, we are starting to realize that I have a voice, I have a choice, and there are other women there that are talking about this, so I can too. I can normalize it too. Why can't this be a topic that we talk about?
Yeah, it's almost like taboo. It's been taboo,
It's very
and
taboo.
it's great. It's
Even in my
great that
office,
it's surface.
I have some patients when they start talking, they're whispering and they're kind of like a little embarrassed. And I'm like, we need to normalize just the way we talk about Botox. We talk about erectile dysfunction, like totally normal over a cup of coffee. A conversation that also has to be normalized is I'm not feeling great. I have vaginal dryness, I have laxity, I have urinary incontinence, and it's something that you can talk about. A solution that I did in my office when I opened my practice, a lot of people said, don't put women's wellness in there. It's just for GYNs, focus on Botox and filler. But that's not what my business is about. That's not what my practice is about. As a woman, I want to be collective in my care. I want to feel sexy. I want to feel amazing internally and externally. And I wanted to offer that to my patients. But rarely will a patient come in unless they're referred by someone to say, hey, I have an issue down there. So in my office, I have this huge pamphlet out there, banner, and it says it right there. So it gives them the opportunity to think about it. And then when they come into my chair, they're like, yeah, I'm here still from Botox. And I saw outside, you're also doing something for the vagina? And they like giggle about it. And I'm like, yeah, absolutely. And it's like a girl's world in my office. It's not uncomfortable. We're super laid back. And they're like, I never had children, so I don't think this is for me. And that's another misconception people have. That's not for you because you have. And I was like, oh, well, talk to me. Like, what's going on? So I'm like preparing for her Botox appointment that she came in. And she's like, I work out a lot. And anytime I'm lifting, I start like peeing on myself. And I was like, Okay, girl, I have a solution for you. And now, I've done 3 treatments on her. She feels amazing. She's never had a child. Um, and she's like, I can't believe this is something for me. I told all my friends because we all have the same problem.
Is that because of her physical activity? I mean, so in my household that's happened as well. But we she's had 2 kids,
Okay.
right?
Yeah,
And
it's
it's
just
like,
pressure
but
on
she
that block.
thinks it's because of having the kids.
In her case, it can very much so be. I was pregnant 4 times, gave birth to 4 children, and I will easily admit I too used to have urinary incontinence. Like, I'll just squat and something I'm like, ooh, oh, what was that? And then when you go home and you're smelling your garments, you're like, oh shit. And it's so normal that we need to talk about that. It's normal. It's not abnormal. It's pressure, consistent pressure on that bladder. You just sphincter, gets a little bit loose and you start to dribble. There's a treatment for it.
What is the treatment?
So there is a radiofrequency device that you may use intravaginally, and it helps. One handpiece may create 17 or 27,000 Kegel-like exercises. When we encourage women to do Kegels, majority of us are doing it wrong. You're not consistently engaging all the pelvic floor muscles. So that would be one. So that's more of a electrical stimulation. It's going to contract the pelvic floor muscles, and you literally feel the pelvic floor go ee, ee, all the way to the rectum. Another option would be something more like radio frequency, in which you're able to administer that either by needles, like the Morpheus device. There is one for the vagina, so it's that piece, or just heat and thermal energy. Now, that's for urinary incontinence. This particular platform might not be great for a patient who has laxity. So, if we're thinking about tone, so when I do a bimanual exam, I ask my patient to squeeze to assess their tone. And prior to me having this particular device, about a year and a half ago, I had a patient who came in for that treatment, and I assessed, and she had zero tone, like zero tone. And I told her, the CO2 device I have is phenomenal, but it's not for this particular indication. And I have nothing to offer you, to be honest. Like, you can go to another practice or just hold off until I bring on this platform, because that was the projection of my practice as we grew. Vaginal laxity, a CO2 laser would be a better option. For patients that have, for instance, dryness, then radio frequency might be a better option. So it's really like a diagnosis. You have to properly diagnose your patient's condition to be able to assess what treatment modality works best.
What Another question for you? What there I used to hear about the O shot all the time. And like 2 years ago, I feel like it was like
Hot.
always marketed. It was hot. I could hear it everywhere. I feel like it's phased out. I don't know if it's phased out from a provider patient standpoint. From a marketing standpoint, from me hearing about it, it feels like it's phased out. Or is that just normalized now? Do they call it something different? Is it work? Is there something new?
So the O shot, it's trademarked. So in order to use it, you have to pay for it. In my office, we don't call it the O shot. We call it the V shot, because it's basically your blood's PRP that I'm injecting into you. It does work, and it works very well. Um, 2 years ago, I do agree with you, super hot because it was a trend. Things in aesthetics or in the wellness realm or in marketing hit a trend, and it's going to trend, and it's going to either flop and die, or it's going to trend, and raise awareness that now women are like, oh, this is a thing. And then they'll come to you and talk to you. And you're like, yes, it can help you with, if there's dryness, if you're looking for a little bit more excitement, lack of libido, it's going to work well. But if you're having urinary incontinence, it's not for you. Like, it's not going to do anything for you. So that's where it helps us to educate the patients. And then our job as providers is to not sell them something that's not going to work. But it
Yeah.
does work.
Is it is what are the most common treatments you're seeing right now? Like, what treatments are women asking for the most today?
That's a very difficult question to answer, I'll be honest, because my practice is comprehensive. It's like a 360, 360. I offer everything you can possibly think of with regards to women's needs. Obviously, Botox and injectable facial balancing is something heavily booked in my clinic. But with regards to intimate wellness and sexual health, a lot of the device treatments for urinary incontinence, vaginal laxity are my most booked appointments. And then peptides are one of the other ones that we also incorporate. Obviously, hormone replacement therapy when indicated and needed, plus or
Okay.
minus.
Is it all women, by the way, that you?
I see men, I see about 10% males in my clinic, and usually that 10% are the husbands because the wives love what they get here and then they're going to bring their husband. Um, my male patients, I do see for cosmetics, HRT, and then, plus or minus anything else they need in between with regards to their peptides.
Okay, so I got a question for you outside of like for me. I was on TR or hormone replacement therapy. I won't mention the company name, but it was easy. It was telehealth. I've been on it for like 3 years. I had
Okay.
my blood drawn before. I wouldn't say it was like a deep blood drawing experience. They sent me a thing. I poked my finger, put it in like 5 little circles, mailed it back. They're like, hey, your numbers are like 350. Your age, your height, you're active, you're physically fit. You should be at like 1200. I'm over here thinking, wow, okay. Like, I feel fine. I don't have any issues. It's just I hear about like from the gym bros that maybe you should look at it. And I'm in this world of aesthetics. I've been in this industry for over a decade, right? So I'm like, maybe I should be on it, and maybe it'll make me feel more macho, whatever, right? So I get on it. I don't really feel much. So I just feel like I'm supposed to take it. I check in. I got the NP that I have or a subscription to, and I would say in the last 6 months, my back is starting to hurt when I wake up. And I'm like, I'm not like power cleaning, running 10 miles. I mean, I work out every day, but I cold plunge, sauna, stretch. Like I'm pretty diligent in my routine. I take some peptides. I take all sorts of vitamins, right? Like I have a pretty good optics on my health. But I kept reading more that it could be the testosterone that is creating inflammation in my back. And
Mm-hmm.
so, no joke, it's almost been 2 weeks. I just stopped taking it. I'm like, I'm just
And
gonna
you,
stop taking it. And it was inconvenient. It was convenient because I went on a trip and I didn't have it with me. So I was like, oh, I'll just stop. And then when came back home, I was like, oh, whatever. And I
do
feel great. I feel
exactly.
great.
So I love that you're asking this, and I'll tell you why. I am not your typical provider. I don't go based on numbers alone. I hear you first. Your body will tell me what you need. Then I run your labs. They both have to correlate. They have to match. To some degree, variation I'm okay with. But if your labs are low and you have no complaint, I'm not replacing you with anything.
I love that you say that. The NP that I had, it was virtual. I should have went with someone I knew. It was just convenient. I live in a town that's a very affluent town, but it's hard to get here. It's a small town at a beautiful beach. So like access to providers are challenging. That's gotten better over the last couple of years, but I feel great. And I was telling my wife recently, I'm like, what, like, why do I feel I'm off everything and I feel amazing? And I don't know if it's like my body saying, wow, you were like, I'm glad that's out of your system. And, so I love that. It's almost like listen to your body over the numbers. Don't just look at the numbers and make a decision because your numbers and how you feel is completely different from patient B, right?
Absolutely. Um, I hate to say this, but I have to say it. We are in a space that is cash based. So if a particular practice or provider needs to make their sale to keep their lights on, they're going to make that sale. And part of my retention, I'm going to be really like humble and say it's 90%. It's probably higher. I've had the same patient for 13 years, 10 years, 2 years. Whenever you walk into my door, I rarely will lose a patient. Why? I don't need to make a sale from you today. I don't need to take money from you today. I can just talk to you today. Obviously, I charge a consultation, and then you can go. Like there's no urgency, and that one one thing has allowed my business to grow in exponential rates by just being honest. People are so educated today, so well informed. They can see which provider is genuine, has their best interest at heart, really is advocating for their wellness, and they're going to come and they're going to bring their family, their kids, everyone to you, and your business will grow no matter what. You're going to always find growth if you're being really authentic and genuine and trustworthy. My patients trust me. If I say no, it's no. If I say yes, it's yes. they won't question it because they know I genuinely have their best interest in mind. It's not about a ching sale for me. And I can assure you, you're probably never going to go back to that provider again, nor for anyone else. Versus if she was like, hey, your numbers are a little bit low, but you're not having any complaints. Let's revisit in 6 to 9 months, even a year. If things change at the time, I'll probably give you something.
It's so refreshing to hear that, because we're desperate for expertise as a patient, desperate for it, like authentic trust, reliability. We're going to continue to age. Our body's going to change. I don't want
Absolutely.
to change provider. I want somebody that I can rely on, I can count on, I can grow with. And so for the audience, for the listeners, what she just said is how you should be communicating with your patients. It is honesty. It is being authentic. It's not about a transaction today. It's not about how long you can be in business today. It's about how long you can be in business forever
Correct.
and building that connectivity with the community, right? And then that community builds this trust, and the business just starts to build itself because you're giving them the actual education and advice that they need to receive in order to, we just want to feel good and look good. And I've come to realize there's no magic pill out there. I wish there was. So,
You also do the work. You have to sleep, you have to eat well, you have to exercise. What we do supplements all that other good stuff.
where do you see intimate wellness heading in the next 5 years?
In the next 5 years, it will be a category that is like Botox because we women know we deserve it. We're going to talk about it. We're coming for it. We want to have our place in getting everything. So I think it's going to be a big hit. 5 to 10 years, it's going to project very well. Some people will flop out of it if you don't know what you're doing and you're just trying to buy a machine to make a sale because you don't understand what works, what doesn't. But I think it's phenomenal. It's regenerative aesthetics and women's sexual wellness will be driven by men, not even women anymore, because men are realizing she's happy, she's great, she's feeling her best at her 40s, and they're helping drive this movement.
I completely agree. Like, I think it's like almost like the goal is like if you can make the husband happy, because the wife is, she's trying to figure out, or the significant other is trying to figure out something's not right, something's not working, and she can feel the pain through her spouse, right? And he's like, what's going on? This is not. And then it's almost like she's probably questioning her confidence. Is she happy? Is there a problem in the marriage? Maybe not. All these like crazy thoughts that can just spiral something out of control. I would be curious to know what the divorce rate is from age like 40 to 45 versus I don't know, maybe call it like 30 to 40. Maybe that, I bet there's some, I don't have the data on it, but I know a lot of people going through divorce right now are between like 40 and 45.
It's because there's a lot of instability in their relationships that can stem from multiple factors. I'm not going to say it's just sexual health or hormones, but that's a big component to it. Men are getting frustrated because they're not able to communicate or understand, like, what do you want? You're bipolar, you're crazy. And to
Yeah.
some degree, that is correct, but it's because of the physiological changes in her body. Her body is like going through a tornado of mixed things. And the sooner we can pinpoint those things and address and help guide that treatment, the better that relationship is and the stability in their home. When women are in their perimenopausal stage, it's such a scary place for women because we're not understanding what is going on in my body. Why do I feel miserable? The way he drinks and breathes is just irritating me. My kid is driving me insane. My tolerance, you're moody as hell. Your hormones are off. You're probably feeling lack of self esteem, your confidence, your skin is aging. A lot is going on collectively at one time, and we're not getting a break. We're expected to still be our best at all times. And society's harsh on women. We have to be the best wife, the best mom, look good, work. Our plate is so full. So sometimes those little things have huge impact. I believe if you look good, you feel good, you perform good. So it's all collective. In that 40s, 50s age, you're going to get so tired and you're going to get divorced because you're like, you know what, that's the only solution because I don't see anything out. In my office, a lot of my patients will share a lot of their lifestyle, life stories, styles, everything. I know your husband before your husband walks into my door. And sometimes it's just that you just need a little tweak here. Maybe a little Botox or lip filler is going to make you feel spicy and pizzazzy. Maybe putting you on some GLP-1s to lose some weight to make you feel confident in your lingerie. And then you kind of help build on that. And those relationships really foster and grow into something amazing.
Yeah, it's like the second part of the marriage. It's like if you can get through it and you can address it, right? And I think if she keeps hearing you're crazy, what's wrong with you, what's going on, and he's it's like over the course of time when somebody just receives that type of treatment from hearing, and maybe it's not even meant to be like verbal abuse, but it's just like you're crazy, what's going on today, like man, you're all been like this for like a while now, like why is you're changing. It's just going to pull you further and further and further and further apart. And really, I mean, to your point, and from your your background and your experience, it you can re-spark the relationship by feeling good, looking good, having confidence, performing well, right? And I think, like, I guess, like my last question for you would be, from a sexual wellness play and a confidence and overall happiness. Uh, does sexual wellness play in, like, how much does sexual wellness and confidence play in overall happiness from your standpoint?
It's all connected. It communicates with the receptors of your brain that feel good, that safety, that security, that confidence. It all translates into your everyday life and your way of life. So, in my opinion, and clinically, it's all of it. Sex is important. Sex matters. Feeling confident matters. It all connects together with your brain, and it is the outcome that you bring forward of your face, like what you bring forward.
Yeah, it's so true. I mean, there's a stat out there on how many guys think about sex in a particular day or whatever. I don't know what it is. We could Google it, figure it out. But it's high, right? It's high, and we're made
Society
we're
that women are not sexual. No, they are.
they
They're just
are.
either embarrassed or shy or not confident.
Yeah, yeah, yeah. It's so true. I've loved this conversation. I really, really appreciate the vulnerability of it, the honesty of it, your approach to helping patients, females, males, family, confidence, intimacy. I'm thankful for people like you that are talking about this, performing it, helping people. And really honored to just have the ability to have you on for 40 minutes and have the discussion. So I really appreciate it. I know you have patients to see, and women to heal, men to save, I guess.
Yes.
But if people want to connect with you, Bushra, where's the best place? Is it Instagram, your website?
Yeah, so our website is lystyaesthetics.com. My Instagram is Dr. Bushra_PA. And you can definitely reach out to us through either the clinic, our phone number is 631-277-6654, or the website. I have an entire team dedicated to servicing our patients.
Thank you so much. You guys go follow her. It's Dr.Bushra_PA. She's on Instagram. She's got incredible content. Her facility is beautiful. She's got all sorts of before and afters, people talking on her stories. Definitely go follow her. We have like 27 mutual followers, right? So we're very tight within the community, and go follow her company. Go check her out. Especially, I know she has people flying to go see her. So if you're having this problem or want further education from her, connect with her. She's definitely an expert in this field. So, the future of aesthetics isn't about looking younger. It's about helping people feel confident in every part of their life, emotionally, physically, sexually, hormonally, and mentally. And, people like her are ultimately changing the way that we approach it and how we help one another throughout how we're living. So I'll leave it at that. Until next time, happy injecting.